Welcome to the Helpful Pharmacist Weekly Live Podcast, where we talk about all things health. My name is Kris. I am a biochemist and a helpful pharmacist. And today we're going to be talking about some health-related issues, as well as taking questions here in the channel. So if you have any questions about anything pharmacy, health, supplement, wellness related, whatever it may be, feel free to post those and I can give you some individualized information. Again, the goal of these is to do some one-on-one or make the information we talk about a little bit more personalized. I do have a conversation to go over today, so if there aren't any questions, I will have a presentation to give or a topic. The topic today is how to interact with your pharmacy. So this is a kind of a summary of all of my experiences, kind of boiled down into a quick little 20-minute conversation. It has all the different concepts and ideas that we see in the pharmacy and ultimately presents what I see as being the problems. So the takeaway from today is that you're going to be able to better interact with your pharmacy, have a better idea of what's going on and why it's going on, and what you may or may not be doing to contribute to that. So let's get into it. So again, the topic is how to interact with your pharmacy, and I am actually going to be able to share my screen with you guys. So let me pull that up. So we got that going. Okay. So I think, again, this picture says it all. I think everyone's been there. Sometimes it's late at night. You got an issue, cough, headache, flu, GI issues, whatever it may be. And you go to the pharmacy or you go to a store that has pharmacy stuff, and there's this giant wall of products. It's wider than my arms are, taller than my arms are. There's hundreds, it seems like thousands, if not millions of products, and you have to struggle to figure out what's going on. So I just really think this photo captures what most people are experiencing. So before I kind of talk about the problems and how to fix them, I just want to make sure everyone's on the same page here about what a pharmacy is, because I think this actually is probably one of the biggest problems. So I think a lot of people think that the operations of the workflow in a pharmacy is very straightforward. It's very simple, and it takes a few seconds to do things. I'm not here to say that it's the most complicated thing, but it definitely is complicated, and it definitely takes steps. And so I want to kind of break down some of that. So I think the biggest problem that people misunderstand is that in the pharmacy, what we're really doing is we're actually translating something. Typically, you go and see your doctor, you have that conversation, they diagnose you, they generate a prescription, it gets sent to us, and then we have to translate all of that into the medications. And there can be some issues in the translation that we have to clarify. So there could be the drug, the dose of the drug, the usage of the drug. There could be issues with the insurance company. It could be a drug that's not currently available to procure or in stock. And we have to kind of, again, translate all of those factors into the final product, and that takes time. And sometimes it has to be personalized because we know based off your medication profile, this medication isn't good for you or isn't best for you, and we may have to have some input. So it's more than putting tablets into a vial. It requires communication, documentation, third-party approval with the insurance company, having the right drug in stock. And that last one is a lot more complicated than you may think. And the example I have here is that depending on how you look at it, there can be more than 20,000 different prescription drugs available in the United States at any given time. So obviously there's no way the pharmacy is going to have all of them. And that's why sometimes we don't have it in stock. We have to order it. It may take some time, or it may not be available. So I think that's also a really important thing is people don't realize that all the medications, the supply goes like this. Sometimes they're always available, sometimes they're harder to get. So I think that's important. And I do also want to say, regarding what is a pharmacy, it's also oftentimes a really good place to ask simpler questions. So for example, if you hurt your wrist and you're not sure what to do, that's a great issue or question to bring up. Or if you know you have a diabetes issue or a pre-diabetes issue and you know your blood sugar has been unusually high or unusually low, you could have a potential conversation with the pharmacist to get some input. And oftentimes what we can do is we can either help you, either directly or provide you information, or say, you know what, that is a serious issue. You need to go talk to the doctor about that one. Why that can matter is sometimes patients go to the doctor with a question that maybe didn't warrant seeing the doctor. It's something the patient could have figured out the pharmacy or some self-education. So again, we're a good check mark or check stop on that process, and we can help you figure out if you're going in the right direction, if you're going in the wrong direction, if you need to talk to your doctor, if you don't need to talk to your doctor. And a lot of times that saves you a lot of time and energy, maybe even some money. So I think that's an important thing to be mindful of is in the pharmacy, we're translating stuff into personalized outcomes. That does take time. There are other people at play, the doctor, the insurance company, the drug wholesaler. All those things have to be lined up. So the most common problem we have in the pharmacy, and I think this is almost without exception, is time. We never have enough time. Somebody shows up and they want something within 5 minutes. And unfortunately, oftentimes it doesn't work like that, especially if we weren't given advance notice. The example I have on my slides here is the patient calls at 3 o'clock and they want something to be ready at 6 p.m. that same day. Well, if I don't have the medication in stock, I definitely can't make that happen. If I have to clarify something with the doctor and they're not available or they're closed for the day, obviously that's going to be an issue. And if there has to be a prior authorization or there's an issue with the insurance and I have to call them, they may not be available. So a lot of times calling the pharmacy and thinking something's going to be done within a couple hours definitely is possible, but it's not always possible. And it's definitely not optimal, especially if you want us to really put time and energy into it. If you're on complex medications, if you need a consultation, the more time you give us, the better. And so again, some examples that time plays a factor into is going to be the medication's not in stock, insurance has an issue, the prescription, we don't have it, there's an error with it, we get that all the time, they send it to the wrong pharmacy, they type something wrong, something's missing or incomplete, we have to clarify it, that can take time. And if the provider is not aware or not available, it takes even longer. And oftentimes these take more than one business day to resolve. It often can be difficult to get a hold of the insurance company and get something fixed, or get a hold of the doctor's office and have it fixed same day, especially if it's a Friday or a holiday weekend. So that's another major silver lining in this conversation. If you expect something to be done on Friday night or the Friday before a holiday weekend, there's a much higher chance it's not going to get done. So that takes us into our first point here, which you can kind of already guess, is be proactive. Do not wait until the last minute. Do not wait to the day of. Typically, it's going to cause a problem. And it may not cause a problem with everybody, but I can tell you every single day, if we have 30, 40, 50, 100, 200 patients, I guarantee you we're going to have multiple patients that fall into that situation. They need it now, and it can't be done now, and it causes a problem. And we get it. The last thing we want to do is not give you what you need, but you also have to realize that we're in the middle, we're translating things. And if what we're being given or what we have to push it into is having an issue, we're limited in how fast we can fix it. So I think a really good way of thinking about it from a patient standpoint is that worst case scenario, it takes 3 to 4 business days to fix a problem, and you should really be interacting with your pharmacy under that timeline. Anytime you engage with the pharmacy and you need it sooner than 3 business days, we definitely can make that happen. We definitely want to make that happen. We cannot guarantee 100%. We can do that 100% of the time. Typically, it takes us 3 or 4 days to have a full 100% guarantee for the things I recommended or outlined. And so that's why, again, I really encourage all patients, you really want to call 4 to 6 days in advance is an ideal time frame. That allows us to make sure we have the right drug, the right dose, and the right quantity, so we don't have to partial refill it. It allows us to fix any insurance issues, especially if it's a new drug with prior authorizations. Also, there could be issues with the copay. So a lot of times patients show up, the copay's gone up $20 or $30, they're in a hurry, they don't have time for us to fix it, and they just pay the difference. So a lot of times there can even be a monetary issue. And then another big one is allowing us to have all your medications at once. The example that always comes to my mind is I had a patient who came to the pharmacy 14 times in 1 month to get their refills because they kept refilling things one at a time or wanting things when they wanted them, and it's just not good for anybody. And one of the next points is how you fix that. But definitely being proactive allows us to have all your medications ready at once, which is also good for everybody. That's the single biggest thing. That's going to prevent almost all the problems. And I can almost guarantee if you're calling the pharmacy 4 to 6 days in advance, when the day of comes and you need that medication, there should be no reason why it's not ready versus showing up, having to wait, getting frustrated, having to come back, all that stuff. So that's definitely going to be the number one lesson is got to be proactive. Second point here is going to be a term that's called medication synchronization. And basically, this is a fancy term that says we can have all your medications filled on the same day. Now, you may be asking yourself, I don't understand why that's not already the case. So typically, patients get prescriptions added one at a time. So you went to the doctor in January, you went to the doctor in July, you went to the doctor in December, and each visit they maybe change 1 or 2 prescriptions, which typically means those prescriptions are written on different days. And typically, you want to get that prescription filled after you get it. And that's why a lot of times patients who have multiple medications, they all end up being due or running out on different days, which is a lot of times why they have to come multiple times a month. So medication synchronization is really great because what we do is we call the insurance company. We say, hey, we want to get these all done on the same day. It's going to be better for everybody. It's going to boost the patient's compliance, all that good stuff that's important. And what they do is they give us an override. They say, okay, that sounds good. We're going to change the profile. So this month you can refill all these prescriptions early. So normally if I fill a 30-day supply and I try to run the claim through the insurance after 20 days, I get a denial. It says refill too soon. With this insurance med synchronization override, it allows it to go through. So what happens is I refill all your medications on the same day, and then going forward, it's always going to be the same day every single month. And that's definitely a huge advantage. It's less trips to the pharmacy, less phone calls to the pharmacy. It's less moving parts for everybody. It really simplifies the process. Again, it allows the pharmacy to work faster, easier, and again, reduces last minute issues, because also with med synchronization, we typically run those on a separate report, and we know in advance, okay, this week we're going to run the following profiles through, and we proactively prepare ourselves for that. So it really simplifies all the processes. And again, from a patient standpoint, it means less calls to the pharmacy, less trips to the pharmacy, and less likely of going to the pharmacy and not getting what you want, which is really what matters the most. So again, a lot of patients haven't heard of this. So we also want to introduce the concept, again, medication synchronization. You call your pharmacy, they take care of it for you. This is not something the patient has to do. And if you want to set it up, again, just call the pharmacy. Typically, I would recommend you ask to speak to either a pharmacist or a lead technician just to make sure it gets done correctly, and then ask for your profile to be put on MedSync or medication synchronization. They'll know exactly what you're talking about. It does typically take them, again, 3 to 4 business days to get that done, because they have to call the insurance company, get all the things set up, get it set up internally. But once it's set up, it's really easy. So I think if I was a patient, or if I was talking to a patient, again, being proactive is a general concept. If I wanted to give them one really specific piece of advice, med synchronization. This is especially important for seniors, people who are caregivers, manage other people's medications, and people who are on a lot of medications are really important. So we've been talking about before about diabetes. So you could have diabetes medications, cardiovascular disease medications, neurology medications, pain medications. You could be on 5, 6, 8, 9, 10 medications, and they're all really important. The last thing you want to happen is go to the pharmacy and not get all of them. This is going to be the easiest way for everyone involved to prevent that. So I think that's probably the single best takeaway from today, besides being proactive. The next one is you need to learn how to somewhat self-manage your pharmacy profile. Because what happens is the pharmacy typically never looks at your profile until you call. So again, if you call the day of, they're only looking at it now. And there's a lot of issues that can happen with your profile that take a day or 2 to fix. And because the pharmacy is not proactively managing it, if you call that day and you have that problem, you're basically not going to get what you need. So the number one question everyone needs to know first and foremost is you need to know when to run out of medications. The last thing you should be doing is calling the pharmacy saying, I have no more medications, I need my medication today. We get that phone call all the time. It's not good for anybody. It's definitely not good for the patient, and it causes a lot of problems. So you definitely need to know when you run out, and that's how you're going to know to call 3, 4, 5, 6 days in advance. That's a huge piece of advice. The next one is you need to know how many refills you have left, because another thing that happens is patients call in, they want to get a refill, and we have to tell them, unfortunately, I'm checking your profile now, and you don't have any more refills left. And oddly enough, the doctor's offices typically automate and batch refills. It definitely can take more than 1 business day to get that refill processed. So again, if you're not checking your refills, if you run out, you call the pharmacy, they look for the first time in that month, they tell you don't have any more refills, it's going to take a day or 2. And just so you know, by law, it has to list on the prescription label how many refills you have left. So usually on the bottom right-hand corner of the prescription label. So it's very easy to say it's going to be 01, 02, 03, 04, 05, whatever it may be. That's how many refills you have left. So that's something you can pretty easily check. Another one is also, when does the prescription expire? This is another common question. Patient calls a pharmacy, needs a refill. They refilled it last month in August. Now we're in September. And unfortunately, the prescription expired at the end of August. So I don't even have an active prescription for you. Same thing, I got to call the doctor. I need to get a new prescription. Sometimes the doctor wants to actually see the patient because they know it's been 9, 11, 12, however many months since they've seen you, and they want to make you come in to get a checkup so they can evaluate you. So sometimes they'll kind of reluctantly not give refills or new prescriptions in that situation. I had that happen last week, twice actually, where I called a clinic to get a medication change or medication added in that case. And because the patient hadn't been seen, and one of them they hadn't been seen in 6 months. The other one, they already had a pending appointment. And so they said, we're going to wait till the patient comes for the appointment. That can cause issues as well. And it does also require by law on the prescription label to say when it expires, the prescription. So you can also see that on your label. Just so we're on the same page, I practice in California. So in California, prescription's good for 12 months after the written date, and a controlled prescription's good for 6 months. So just so we're on the same page, prescriptions don't last for forever. They either last for 6 months or 12 months, but not longer than that, which means every 12 months at a minimum, you're gonna need to get a new prescription, and that can become a problem. So I think that's important. Some of the things here I already mentioned is they take 1 to 3 days to get a new one, sometimes longer. Again, has a set number of refills. Typically, they give you 6 months or a year. So again, if you use all those refills, we have to call. And then again, sometimes they either want to wait until you're seen to give you more refills, or they could even be out of the office or on vacation, and that could take, weeks. So again, you need to learn to manage your pharmacy profile to prevent these things from happening. These 3 examples of I ran out today, I don't have refills left, or my prescription expired, I would say it's probably 1 out of 5 problems in the pharmacy. Probably, every single day, if we get 30 or 40 phone calls, there's going to be at least 3 or 4 of these at a minimum. It's just like every single day it happens. And so again, this is a really important thing to be mindful of from a patient standpoint. And again, especially if you're on important medications, pain meds, diabetes meds, cardiovascular disease meds, medications where you really, 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 really can't miss a dose, these things cause a problem, and we have to scramble. So that's really the 3 big things of how to interact with your pharmacy in terms of common problems that I think people should be mindful of. And again, just to recap, you got to be proactive, which means calling minimum 3 or 4 business days in advance, ideally 4 to 6 days. You should be asking for medication synchronization, so you don't have to deal with the pharmacy once a month. And you need to track your own pharmacy stats in terms of when are you going to run out, how many refills do you left, and how many prescriptions, when your prescription can expire. And just to be clear, almost no pharmacies will manage those 3 questions. No one's going to call you and say you're about to run out. Do you need a refill? No one's going to proactively go into your profile and see if you have refills and then request them. And no one's typically going to call the doctor and say the prescription expired. The patient's going to need it in a few weeks. Can I get a new prescription? It just doesn't happen. So I also want to make sure people understand in terms of on the inside, those things are not going to be done for you proactively. So again, if you're just joining us now on the live stream, we're talking about pharmacy and how to interact with your pharmacy. Again, most people have had a problem with their pharmacy, sometimes every single time. If you have any questions, please put them in the chat here so I can address them directly. Again, the goal is to give some personalized response and information when possible. Okay. So the next issue that comes up a lot, especially one that really bothers me, is that not all drugs cost the same. A lot of patients don't understand that. There can be multiple drugs in one class and the prices are different. And so, for example, certain insurance companies, they prefer one branded drug over another or one generic over another, and they may charge you differently. So again, if you're coming same day and you want the medication same day, and I have to give you what I have, sometimes the copay is higher. I can have multiple generic brands of the same, I shouldn't say generic brands, generic manufacturers of the same generic medication, and I can run them through the system and the copay is going to change. It's not always the case, but it definitely happens. And I've seen instances where the copay can go from like $25 to $5, $50 to $20. It definitely makes a difference. And so the more time you give the pharmacy, it allows them to be proactive. What I try to do is when I run refills through, I'll compare it to the prior copay cost, or just kind of look at it and have a general idea of how much it cost. And a lot of times if it's too high, it turns out we're billing the wrong generic manufacturer from the time before. That's why the cost changes. So again, a lot of these things not only going to save you time, but they're going to save you money. So again, number one takeaway in terms of not all drugs cost the same is you really want to confirm your copays before you get your prescriptions. And ideally, when you call the pharmacy to ask for your refill request, they really should run the claims through with you on the phone and then provide you the copays over the phone. Or if they don't do that, you should call back that same day or the next day because you're waiting 3 to 4 days before you need them and say, hey, what are the copays? Because again, what will happen is a patient shows up to the pharmacy, they need the medications that day, the copays are higher than normal, patients don't feel like they have a choice, they have to pay more money. I think that's an important one. And I have some examples here. Again, these next examples are more so for cash paying patients, but for example, Farxiga and Jardiance are basically the same medication for most purposes. Farxiga, the cost is $400, and Jardiance, the cost is $590. So a lot of times, depending on your insurance company, the copays won't be the same and the medications are more or less equivalent. That doesn't even include for formulary. So there's going to be a lot of examples where similar medications like Jardiance and Farxiga, the copay or the price may be very different. The next example is for patients that are diabetic, who use insulin. If we look at the generic Humalog, which is generic Lispro, it's going to be $24 per vial. The brand $64 per vial. And Admelog, which is another brand, is $94 per vial. So you have the same drug. There's literally no difference. And you could be spending 3 or 5 times more money for the same drug. And especially if you're a cash paying patient, there's absolutely no reason to do that. I'd also add that typically, not always, the copays are somewhat of a percentage of the cost of the drug. So generally speaking, if you were getting a generic drug that costs $24 versus a branded drug that costs $94, your copays aren't going to be the same. So even if you're going through insurance, there's a huge benefit to make sure you're getting the generic when available. So I think that's an important one. Again, we kind of already mentioned that if the copays have changed from the prior fill, you definitely need to ask why. Oftentimes it's because they didn't use the same generic manufacturer or something's going on, and you definitely don't want to waste your money. So definitely ask why. Again, that takes time for the pharmacy to look into it. Typically, if someone asks me to look into a copay, my first thought is going to be minimum 30 to 60 minutes because I'm going to be multitasking while I do it. And ideally, I'd like to get back to them the next day. So again, if you want them to help you, they need time to help you. So if you give them that time, you're most likely going to get better help. So if you can say, you know what, I don't need this medication for a couple of days, especially if you're on the phone, you verify the copay over the phone. Why don't you call me back tomorrow? That's going to be a much easier outcome for the pharmacy to do. And again, they're trying to help you and trying to help you save money. So it's in your interest to give them what they need to help you. So I think that's important. Also, again, want to mention that if you have high copays, always ask if there's a cheaper alternative, whether it's brand or generic or different generic manufacturer. Oftentimes I can sit there and I can try a few different generic manufacturers and definitely the copay can go down. I had one example that comes to mind. This was about a year ago now. This patient was getting a fairly uncommon muscle relaxer that we don't see very often. And they billed through the generic manufacturer had in stock. And I think their cost was $700 for a month, which was really extreme. And as soon as I saw that, I'm like, okay, there's a problem. I'm not even going to tell the patient. I'm going to keep going because that's what I like to do. I tried a different generic manufacturer, and I think the copay was $10. So that's an example where by catching the copay and spending 5 minutes to look at what other manufacturers are available or what was used last time, I saved the patient about $700. And again, that's per month. So sometimes you'll actually see patients that not only pay that $700, but they keep paying it for multiple months, and they could, spend thousands and thousands of dollars more than they need to before someone finally realizes, hey, what's going on? So that's really sad. That breaks my heart when I see that. Also want to include, in terms of not all costs being the same, for people who have commercial insurance. So if you have Medicare, Medicaid, or Medi-Cal, those are government insurances. This typically doesn't apply. So if you don't have one of those, if you get your health insurance through your employer, typically you have commercial insurance. Most manufacturers of branded medications offer some type of a discount or rebate program. So for example, on a medication like Entresto for heart failure, or Eliquis for blood thinner, or for anticoagulation of cardiovascular disease, if you go on the manufacturer's website and you have commercial insurance, they'll typically give you 3 to 12 months of medication for free, which can be a huge benefit for people because you may have a $30 or $50 copay on that. And again, if you have commercial insurance, they want your business, they're going to give you a discount. And sometimes it's even for free. So definitely if you have high copays or high costs and you have commercial insurance and they're branded medications, definitely go on the manufacturer's website and see what discounts they offer because typically they have an offer. It can save you a lot of money. That's a really popular one. The last drug-related thing we want to mention here real quick, because this one comes up a lot too, another one that breaks my heart, is if you're not using insurance, you're going through cash. So you're going to pay the pharmacy cash. We call it cash pricing. You need to be mindful that a lot of pharmacies take advantage of you on this because it's not super transparent what the prices are. A lot of times they can charge whatever they want and they get people to pay it. So I'll be honest, I'll raise my hand. This happened to me one time. I was kind of busy and I was giving the patient a clinical consultation. I was really focused on that. I didn't look at the price until the end. And I wasn't familiar with the price of this drug because it just come out. but they came into the pharmacy. They wanted to buy a Zepbound for weight loss. They were paying cash. And it was one of the first times I dispensed it. I was not familiar with it. The patient had a lot of questions about side effects, how it's going to work, how they're going to inject it. We spent 10 or 15 minutes talking about that. I rang them up. It was $1,400 for 1 month, which is a lot. But those medications, they're somewhere in that price range. It didn't stand out to me. I got a little curious afterwards, and I went and looked at my cost. It turns out my cost was $1,000. So in that case, the business owner, who wasn't me, I didn't make the decision. They marked up that medication $400 on that patient, which is a lot of money. If you think about $400 a year, that's an extra $5,000 a year roughly in additional cost. The example I give here, the point that I use with people is she could have gone on GoodRx, which is a website on the internet. Just type in GoodRx in the name of any drug, and they'll list basically cash pricing that they've somewhat negotiated. In that case, the GoodRx price for that same drug was $1,100. So if she had looked at GoodRx and gone to a GoodRx pharmacy, she would have saved $300 on that one. I actually ran out of the pharmacy when I saw that to try and find the patient. I was in the parking lot looking around trying to find her. I couldn't find her. I felt horrible. Again, I wasn't familiar with the medication. I didn't think the market was that much. So my point here is you need to be mindful that pharmacies take advantage of people with cash pricing oftentimes. And the easiest way to verify this is go on GoodRx. Go on GoodRx. Anytime an expensive medication comes through, you have expensive medication, and get an idea of what they're going to charge. And that way, when you talk to the pharmacy, it's a good way to kind of get an idea if they're being fair with you. I had another example 2 weeks ago. A patient got a new medication. It was a brand eye drop. The pharmacy told them it was going to be $400 a month with their insurance, I believe it was. Yet when you went on GoodRx, it was $200 a month at that same pharmacy. So first of all, the patient wasn't getting a good deal. And second of all, the pharmacy either didn't know or didn't care about what the GoodRx pricing was, and they gave them completely wrong information. So in that case, I was able to save the patient $200 because they needed the medication that day and I didn't have it that day. So I had to go somewhere else. So again, cash pricing is not fair. These pharmacies mark it up a lot. I don't do that in my pharmacy, just to be clear. I don't think that's right, but most people do. And definitely checking GoodRx is a really good way to save some money. So it's a really important point, especially with more branded medications being popular now, like Ozempic, Zepbound, Eliquis, things like that. The last major point I want to include here, just to be complete, is I do want to, toot our own horn, which is that a pharmacist is an amazing resource. Generally, we have a lot of information, and I think the number one thing we do well is we can tell you if you need to learn more or if you don't need more help. So the example earlier, you come in with a wrist pain, I can ask you some questions, and I can say, Advil and Ice, it's going to get better. If it doesn't get better in a week, go to the doctor. Versus you can come in and the risk could just be completely horrible. Go to the ER immediately, go see your doctor immediately. It helps make a decision because you don't want to necessarily go to the ER or see the doctor if you don't need to, and vice versa. So there's a lot of examples where we can help refer you out to the proper place. It could also be something like PT. Over-the-counter medication is a really popular one. Like you have some mild pain, what can you treat that with? Mild nausea, what can you treat that with? You have a cough, what can you treat that with? There's like 30 or 40 different cough products out there. They're definitely not all the same, and the price isn't the same. So again, knowing which one's going to be best for you, which one's going to be cheapest, pharmacist is great for that. So just some examples. Oftentimes we can tell if something's really wrong within 30 seconds. I know what the conversation is going to sound like. I have these conversations all day long. And when you have something that's really serious or significant, it stands out to me. It's very obvious we need to do something here. Again, we can tell you if you need to be referred out or if you can wait. We can also help you understand if there's a less costly medication available, like Farxiga versus Jardiance, or using GoodRx for Zepbound instead of getting ripped off for someone else's cash pricing. Another one that a really good pharmacist will ideally do, especially if you give them time in advance, is they'll call their doctor for you. So a lot of times I'll do that if a patient comes in and they just have a really bad problem. I'm really concerned. Their blood sugar is really high. They think they have a UTI and they're diabetic. There's something really weird going on. Oftentimes when the pharmacist calls the doctor's office, things get done faster. So that's another big thing is if you called your doctor's office and they gave you the runaround or they didn't give you an immediate follow-up, oftentimes if the pharmacist calls, it gets done faster. In my mind, you can hold them a little bit more accountable because they do legally have to do certain things for their patients and the pharmacist can better point that out to them. I also think that if they don't do it and there's an issue and the pharmacist is involved, they understand there's a little bit more liability there. So again, my point is if you're having an issue, you need something done rapidly, having an issue with the doctor's office, having the pharmacist call, not always, but oftentimes gets things done faster, especially if you have a complex need and it's complicated. You may not use the right words, you may not use the right terminology, versus the pharmacist can be A, B, C, D, E. We use the doctor's language. It's very easy for them to sign off on it. That's an important one. If you have a complex issue, you started having some type of, change or concern, we can also point you in the right direction. You can go to this place for that. You can go to this place for that. If I were you, I'd see a specialist. If I were you, I'd go to urgent care. If I were you, I'd go see your PCP. If I were you, I'd self-treat. We can, again, point you in that direction, kind of break it down. And then again, my favorite, as you probably could guess, provide education and re-education for your disease states and your goals. Again, most patients aren't going to be able to understand the information the first time they get it, which is why re-education is so important, whether it's in writing or in videos, whatever it may be. Most patients are going to have to see something a couple times before it really sticks. And because we're typically the second or third person they talk to after the doctor's office, we can provide that re-education, remind you what was said during that visit. I think that's important. I also like to think we can translate a little bit. As you can see here, I don't use only fancy words or only words with 9 syllables. I use 1 or 2 syllable words too. So sometimes I think patients get a little confused with all the terminology that the provider uses and the doctor uses. And so the pharmacist may be able to explain it in slightly more simple terms, which may be more effective or able to help you understand what's going on better. And again, that's a really big one. Talked about it before. Health literacy, which is how well a patient understands a concept or idea and how well they can apply it to their own health, is basically the number 1 or number 2 driving factor of outcomes. So again, if the doctor uses words you can't understand, you're going to have lower health literacy. If you come into the pharmacy, you have a simple conversation, we use more basic terms, and you get that, it empowers you and your outcomes are going to be better. So I think that's important. Another thing I just want to include here about pharmacists and pharmacy in terms of things, if you see at the pharmacy, you typically want to avoid them, is first of all, if everyone's always frantic in a hurry, that's not a good sign. If a pharmacy is always frantic, always in a hurry, always chaotic, typically means they're not organized properly, they're not run properly, they're not going to do the best job of helping you. And I'd say they're more likely to make a mistake. So if you see that, definitely stay away from it. If the counter's always messy, it's always disorganized, they got piles of paper, piles of bags, piles of trash, definitely want to avoid that. That's not a good sign. A good pharmacy is always organized. You can almost make the case that's the number 1 trait of a good pharmacy. You got to be organized. The next one is if the phone's always ringing, but nobody's answering it. Hi, I'll put you on hold, click. Hi, I'll put you on hold, click. Hi, I'll put you on hold, click. That's not a good sign. Whether you're there in person or if you're on the other end, you want to avoid that. So I've actually given the advice before, which I think is really good. If you're looking to change pharmacies, call the pharmacy and see if they put you on hold. Or call the pharmacy and ask to speak to the pharmacist and see how long it takes. If they don't put you on hold or they transfer you straight to the pharmacist, or only takes a minute or 2, that's a good sign. Versus if before you say anything, they put you on hold, it takes 20 minutes to even speak to someone, and they put you on hold again to talk to the pharmacist, and it takes you 20 minutes to get the pharmacist online, and they're super frantic. You want to avoid that. Again, you should never be put on hold for forever. That's not a good sign. I actually was helping out someone a couple months ago because there was a medication they needed that day, again, that I didn't have. And so I offered a call for them. Every chain pharmacy I called, I was on hold for at least 10 or 15 minutes. A lot of times the call dropped. I couldn't speak to somebody for a while or at all. And I will also add, being a pharmacist and knowing what's really going on, they also lied to me. So multiple times where they said they can't get this medication. I know they can get this medication. This is common medication. Or they gave me a price that was hundreds of dollars over the cost. So again, they're inflating their cash pricing. So again, I think that there's a lot to be said about a frantic, in a hurry, messy, disorganized, phone always ringing type pharmacy. You just want to avoid those. So that's really the information I have for today. Again, if you're just joining us at the end here, we're talking about how to better interact with your pharmacy. I think this is a hugely important topic because I'm always seeing patients that don't understand this and it causes problems. So just to summarize what we went over, ideally you want to contact the pharmacy 4 to 6 days in advance of needing a refill. That way it gives them time to talk to the doctor order the drug, deal with the insurance company, and get everything ready at once. Super important. We also talked about making sure that you have refills left and that your prescriptions haven't expired, because again, those things can take time. And again, this also requires you to know when you run out of medication, because you definitely do not want to be calling the pharmacy when you run out. Nothing good's going to happen there. That's the first point. The next point is everyone who has more than 1 or 2 medications should be on medication synchronization. Again, this means the pharmacy calls the insurance company and gets all of your medications allowed to be filled on the same day. That way you have 1 day a month, 1 phone call a month, and 1 trip a month to the pharmacy. It's much more straightforward. It's much simplified. It works good for everybody. Next one is that if your copays change, ask questions. And whenever you call the pharmacy to ask for refills, you should be asking them what the copay is in advance, so you're not stuck there at the counter after you wait in line for 20 minutes. They're telling you the copay is $50 more, and you have to debate whether or not you have time to wait and whatever it may be, or if you can't wait, you have that option. But copays definitely change. A lot of times they change because the pharmacy changed which manufacturer they're using, which isn't your problem. They shouldn't be doing. So there's a lot of ways you can save money and prevent frustration by doing that. And again, if the copays change, you should be asking why. And that also means you probably should have a pretty good idea of what your copays were last time. Everyone should know that. Be mindful that cash pricing oftentimes is a time pharmacies take advantage of people, unfortunately. I've seen this quite a bit. I gave the example of Zepbound. We were asking $400 over our cost, but on GoodRx, it was like $100 over their cost. So unfortunately, because I didn't realize that at the time, the patient spent $300 more than they needed to. And also, I would say, even if you're using insurance and the copay is really high, checking GoodRx is a good place to go to, because I had an example even recently where the GoodRx price was better than the patient's copay with their insurance. So that's a really important point. Again, don't waste your money. Don't flush it down the toilet. Check GoodRx. And I also want to just kind of finish by saying, make good use or full use of your pharmacist when in doubt. If something seems wrong, if it seems confusing, you're unsure, or doesn't pass the smell test, talk to the pharmacist. They're typically the decision maker. They're the one in control. They're the one in charge. They have the most autonomy. They can go through the entire workflow at once and pretty quickly get to the bottom. They are going to be the most educated person at the pharmacy typically, so it also helps. And I definitely think people don't ask enough questions and they don't get the information they need. They're in doubt. They have misdecision or indecision, and it causes problems. So again, if you have the ability to, because the pharmacy is organized, definitely talk to the pharmacist. So again, that's the information I have for you guys today. I hope that really helped. I know that those are all the lessons I really wish everybody knew, because like I'm telling you, in a medium busy pharmacy, I probably get those questions at least 10 times a day, 5 times a day to minimum. I'm talking about all day, every day. Patients calling, ran out of my medication today. I don't have any refills. The prescription expired. The copay went up. The medication's not in stock. These things happen all the time. And that's kind of my point with the slide, is that there's a lot of translation going on. There's a lot of outside variables at play here. And I think people have a misexpectation that they can call the pharmacy and get something immediately. It just doesn't work like that. You really need to give the pharmacy a couple days to get everything done. And if you don't do that, typically the patient's going to be the one that suffers. So I hope you guys like this information. There's going to be more to come. So please follow the channel, subscribe. If you have any questions, put those in the comments below. If you want to ask me any questions directly, I can be reached in my email, which is welcome@yourpersonalpharmacy.net. If you're looking for supplements, we have a really nice Pharmacist Curated online store where we basically boil down all the important products from the best brands in one place. That's just going to be on the shop tab on the website. And again, if you have any questions, feel free to reach out. My name is Chris. I'm a biochemist and pharmacist. I'm the helpful pharmacist. And my goal is to empower people to live better lives. Thank you for watching. Hope you guys have a great day and take care.